Good afternoon. This is All India Radio. I'm Tanvi Taneja, and with me is Abhishek Mukhopadhyay with the Midday News. The headlines. Domestic flight operations begin in Andhra Pradesh on the second day of resumption of airline services. Civil Aviation Ministry allows resumption of domestic charter flights. 8 flights to carry stranded Indian nationals to Kerala from the Gulf region under Vande Bharat mission today. Recovery rate of COVID-19 reaches 41.61% in the country, over 60,000 cured so far. WHO puts on hold clinical trial of hydroxychloroquine on COVID-19 patients. Kerala State Education Board exams for class 10th and 12th get underway. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program on All India Radio on 31st of May. In Andhra Pradesh, domestic flight services resumed this morning, almost after a gap of 2 months from the 2 airports of the state. The first flight by a private operator from Bengaluru landed at the Gannavaram airport in Vijayawada early today with 79 passengers. As per the airport director, Madhusudan Rao, the aircraft also returned to Bengaluru with 68 passengers on board. Another flight from another private operator from Bengaluru also landed with 48 passengers and departed with 50 passengers on board. Similarly, Visakhapatnam Airport is scheduled to handle flights today from Hyderabad, Bengaluru and Delhi. As per the state government officials, the passengers who land from Delhi will have to be in institutional quarantine for a week, and then they will have to be in home quarantine for 1 more week. All the passengers in both the airports are being handled as per the Health and Family Welfare Ministry's guidelines. The Civil Aviation Ministry has allowed domestic chartered flights and private jets to resume their operations. The ministry has issued an order in this regard yesterday. After a 2-month gap, the country resumed its domestic passenger flights from Monday. The ministry said that non-scheduled and private operator of fixed-wing aircraft, helicopters and micro-light aircraft can resume their domestic flights from 25th of May onwards. As per the guidelines issued in this regard, the ministry said if a passenger had manually booked his or her ticket for a chartered helicopter flight, the boarding pass will be issued at the helipad or heliport with minimum contact and after following all sanitization protocol. It said passengers should report at the airport, heliport or helipad at least 45 minutes before the departure time. Vulnerable people such as very elderly, pregnant ladies, passengers with health issues are advised to avoid air travel. However, this will not apply to air ambulance services. Price cap on tickets issued by the aviation regulator DGCA last week for scheduled domestic passenger flights will not be applicable on chartered flights. It said the charges of air travel on chartered flights to be as per mutually agreed terms between operators and travellers. The ministry said a self-declaration of Arogya Setu app status would also be obtained that the passenger is free of COVID-19 symptoms. However, in case of medical ambulance flights, medical certificate about the condition of the patient that has necessitated his or her air travel should be carried for the passenger.
In Kerala, the State Education Board examinations started from today, which was earlier postponed due to COVID-19. A report.
The first section of vocational higher secondary exams was held today morning. The 10th standard exams just began in afternoon section. Over 9 lakh students of class 10th plus 1 plus 2 will be attending the state board exams scheduled from today till May 31st. Extensive arrangements including thermal screening of students, disinfection of premises, strict social distancing, compulsory mask and sanitizers usages are being done in all centres. Nearly 5,000 exam centres are there across Kerala, Lakshadweep and Gulf region. Arrangements were made to ensure that all students attend the exam through special transport facilities and the police clearing the way for students to reach on time. Authorities informed that those who miss the exams could write the CA exam which will be conducted later. Meanwhile, as part of the Vande Bharat mission, 9 flights will carry stranded passengers to Kerala today, of which 8 is from Gulf region and 1 from Israel. Flight from Abu Dhabi, Dubai and Bahrain will arrive in Kozhikode by late evening. 2 flights are scheduled to arrive in Kochi, one from Dubai and another from Tel Aviv, which will be reaching in a short while. 2 flights are also scheduled to reach Thiruvananthapuram and Kannur from Dubai and Abu Dhabi today. Over 1,000 expatriates will be reaching Kerala today under the mission. Mayusha for AR News from Thiruvananthapuram.
Railways has operationalized more than 3,060 Shramik special trains across the country to transport migrant workers to the home states. More than 40 lakh passengers have reached their destinations by these trains. Rail Minister Piyush Goyal has expressed happiness that the railways successfully operated more than 3,000 Shramik special trains and took migrant workers from different parts of the country to the home state. In a tweet, Mr. Goyal appealed to all the states to cooperate with the railways and help the labourer brothers. Our correspondent reports that 80% of these Shramik trains are scheduled for various destinations in Uttar Pradesh and Bihar.
Railways had started running Shramik special trains from 1st of May to move migrant workers, pilgrims, tourists, students and other persons stranded at different places due to lockdown. The top 5 states and union territories from where maximum trains originated are Gujarat, Maharashtra, Punjab, Uttar Pradesh and Delhi. These trains were terminated in various states across the country. Uttar Pradesh received the highest number of 1,245 trains, followed by Bihar 846 trains and Jharkhand 123 trains. During the journey, passengers are given free meals and water. In addition to Shramik Specials, Railways is also running 15 pairs of special AC trains connecting New Delhi and has decided to start 200 more trains from 1st June. With Dipendra Anand Kumar, AIR News, Delhi.
The Uttar Pradesh government has decided to set up a migration commission to help find jobs for workers returning home. Additional Chief Secretary Home and Information, Avanish Awasthi said, any state that wants labourers from UP has to seek its permission.
उस आयोग का नाम है कामगार श्रमिक सेवा योजन एवं रोजगार कल्याण आयोग। आयोग के माध्यम से उनका निर्देश यह है कि सेवा योजन और रोजगार के क्षेत्र में, स्किल मैपिंग के क्षेत्र में, स्किल डेवलपमेंट के क्षेत्र में ऐसे जो श्रमिक और कामगार आए हैं, आवासीय सुविधा जो प्रधानमंत्री जी का पैकेज है उसका सहयोग कराने के लिए ऐसे जो व्यक्ति आए हैं उनकी अप्रेंटिसशिप करने के लिए, अप्रेंटिसशिप करने के समय ट्रेनिंग भी होगी, उनको कुछ मानदेय भी मिलेगा।
Chief Minister Yogi Adityanath also said that other states will need permission from the UP government if they want to make use of labourers from Uttar Pradesh. About 25 lakh migrant workers and their families have returned to Uttar Pradesh from other states. At a meeting with senior officials, the Chief Minister reiterated that his government is committed to a safe and respectable homecoming of workers and to providing them with jobs and social security. The Plan Commission will look into workers' rights, prevent the exploitation and provide an official framework to ensure socio-economic and legal support for them. The Chief Minister said insurance, social security, re-employment assistance, provision for unemployment allowance are some of the factors that will be looked into by the Commission.
Health and Family Welfare Ministry said that a total of 60,490 people affected with coronavirus have been cured and the recovery rate reached 41.61% in the country. During the last 24 hours, 2,769 people have recovered. 6,535 fresh cases of COVID-19 have been reported, taking the total number of cases to 1,45,380. The Health Ministry said 146 deaths have been registered in the last 24 hours, taking the nationwide toll to 4,167. Indian Council of Medical Research ICMR said that a total of 92,528 samples of coronavirus were tested in the last 24 hours. With this, the figure of total number of tests reached 31,26,119 in the country. Ministry of Health has reiterated its appeal to people to follow hand hygiene and social distancing norms to contain the spread of COVID-19 infection. In a series of tweets, the ministry has reiterated that as a part of the new normal, people should always follow social distancing norms and wash their hands with soap and water or use alcohol-based hand sanitizers. The ministry said spitting in public is a punishable offence and it increases the risk of the spread of coronavirus. Health Minister Dr. Harshvardhan has said that India utilized the lockdown period to ramp up its healthcare infrastructure. He said the lockdown also helped to keep its COVID-19 mortality rate relatively low. Dr. Harshvardhan said central and state governments have put in place 3,027 dedicated COVID-19 hospitals and COVID health centres. He said India has managed to put up a better fight against COVID-19 as compared to many other developed and developing nations.
डेडिकेटेड अस्पताल 2.5 लाख के करीब बेड्स हैं आइसोलेशन प्लस आईसीयू के। लगभग 2065 हमने कोविड के एक्सक्लूसिवली डेडिकेटेड जो है हेल्थ सेंटर्स देश में क्रिएट किए। इनमें भी लगभग हमारे 1,77,000 जो है बेड्स इन अस्पतालों के अंदर जो है हमारे लिए मरीजों का इंतजाम है। फिर हमने कोविड केयर सेंटर्स जो कि मामूली जो सिम्टम्स वाले पेशेंट्स हैं उनके लिए ऐसे भी लगभग देश में 7,063 हमने कोविड केयर सेंटर्स को विकसित किया, जिसमें करीब 6.5 लाख बेड्स की व्यवस्था की।
World Health Organization WHO Director General Tedros Adhanom Ghebreyesus yesterday said that it has temporarily suspended the clinical trial of hydroxychloroquine HCQ on COVID-19 patients. Earlier in the last week, the Lancet Medical Journal published an observational study on HCQ and chloroquine and its effects on COVID-19 patients who were hospitalized. The authors of the study reported that among patients receiving the drug when used alone or with a macrolide, they estimated a higher mortality rate. WHO had initiated the Solidarity trial to evaluate the safety and efficacy of 4 drugs and drug combinations against COVID-19, which include HCQ. The executive group of the Solidarity trial, representing 10 of the participating countries, met earlier this week and has agreed to review a comprehensive analysis and critical appraisal of all evidence available globally. The review will consider data collected so far in the Solidarity trial and in particular robust randomized available data to adequately evaluate the potential benefits and harms from this drug. Mr. Tedros said that this concern relates to the use of hydroxychloroquine and chloroquine in COVID-19. He reiterated that these drugs are accepted as generally safe for use in patients with autoimmune diseases or malaria.
In a series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Director AIMS, Dr. Randip Guleria, advised the people to aggressively follow the social distancing and hand hygiene norms to check the spread of infection.
Currently, we have to be aggressive in social distancing, hand washing and quarantine, and this is more and more important in the hotspots. I would advise everyone, especially those who are in the hotspots, to really sincerely, as citizens in a patriotic manner, observe this lockdown, because if we observe this lockdown in a sincere manner, we will be able to break the chain of spread and we will be able to bring down cases and be able to prevent deaths and conquer corona in India.
Dr. Rakesh Garg of AIMS Delhi said that the spread of COVID-19 infection takes place through a person having a travel history as well as from those who have come in contact of the infected person.
The COVID-19 is being spread from persons who have a travel history from somebody, or they have a contact which has come from somewhere else and that is an endemic area for it, or a person who is taking care of positive patients and they have not used proper precautions. So they have this positive history. Then probably the chances of COVID-19 will be more. As compared to those patients who does not have any contact history with these patients, not history of travel, they are staying there at home, the chance will be much lesser.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on a Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. Team India captain and well-known cricketer Virat Kohli urged citizens to follow the government directives to stay safe from the virus.
आज आपसे एक भारतीय खिलाड़ी के तौर पे नहीं, पर एक भारतीय नागरिक के तौर पे बात कर रहा हूं। मेरी सबसे यही एक रिक्वेस्ट है कि प्लीज सोशल डिस्टेंसिंग का पालन करें, उसको फॉलो करें। जो भी सरकार ने हमको डायरेक्टिव्स दिए हैं उसको प्लीज पूरी ईमानदारी से फॉलो करें। मस्ती मजाक करने के लिए रोडों पे निकलना अपने देश से ईमानदारी नहीं है। मैं आप लोगों से विनती करता हूं कि प्लीज जो भी सरकार हमें कह रही है करने को, उस चीज का पूरा पालन करें।
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Domestic flight operations begin in Andhra Pradesh on the second day of resumption of airline services. Civil Aviation Ministry allows resumption of domestic charter flights. 8 flights to carry stranded Indian nationals to Kerala from the Gulf region under Vande Bharat mission today. Recovery rate of COVID-19 reaches 41.61% in the country, over 60,000 cured so far. WHO puts on hold clinical trial of hydroxychloroquine on COVID-19 patients. Kerala State Education Board exams for Class 10 and 12 get underway. And Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program at All India Radio on 31st May. For quick news updates round the clock, follow us on Twitter, handle at AIR News Alerts.
Delhi Transport Minister Kailash Gehlot today said that there is no confirmation yet on resumption of Delhi Metro rail services. Speaking to media, Mr. Gehlot said whenever such a direction comes, Delhi Metro Rail Corporation will require a minimum of 2 days for preparations. Mr. Gehlot said Delhi government wants that metro services should be started soon in the national capital. In Maharashtra, the Jagjeevan Ram Hospital at Mumbai Central, a 361-bedded tertiary care hospital of the Western Railways, has been converted into 172-bed COVID hospital, and out of the 555 COVID-19 positive patients admitted, 179 patients have cured and been discharged after treatment. More from our Mumbai correspondent.
The Western Railway has said the RPF was instrumental in procuring and distributing adequate number of PPE kits, masks, gloves, hand sanitizers and liquid soap among the staff. Besides this, since the Jagjeevan Ram Hospital has been taken over by the state government for treating COVID-19 patients, necessary arrangements have been done for accommodation and mess facilities for the staff and railway paramedics performing duties at the hospital. The Maharashtra Police has said in the last 24 hours, 80 police personnel have tested positive for COVID-19 and 2 deaths have been reported. The total number of positive cases in state police now stands at 1,889 with death toll at 20. A total 1,031 are active cases while 838 personnel have recovered. Meanwhile, the richest Ganesh Mandal in Mumbai, the GSB Sarvajanik Ganesh Utsav Samiti, Wadala, has postponed its Ganesh Chaturthi celebrations to 2021 due to COVID-19 pandemic. Sonali Ghadiyar Patil, AIR News, Mumbai.
The Rajasthan government has given permission for operation of taxis and auto rickshaws in a limited number in the red zone areas with effect from today. They are being operated only from the airport, railway stations and hospitals. More from our correspondent.
People stranded at various places due to lockdown are now returning to their homes after the operation of domestic flights and special trains. About 1,45,000 migrants traveled to their home state. 105 Shramik special trains operated by the Northwestern Railway so far. 10 Shramik special trains are being operated today from different stations of the state. Meanwhile, after 75 new corona patients in the state today, the number of infected persons has gone up to 7,376. Jitendra Dwivedi, AIR News, Jaipur.
In Gujarat, scientists of Gujarat Biotechnological Research Centre have completed genome sequencing of more than 100 samples of COVID-19. The state-owned lab is the first in the country to submit more than 100 samples of genomes sequencing at an international level. This will help the researchers to develop a recombinant vaccine against COVID-19. A report from a correspondent.
Talking to AIR, researchers of Gujarat Biotechnological Research Centre said maximum number of samples were taken from places such as Ahmedabad, which recorded highest cases and deaths. To get an overall picture of the state, samples were also taken from other districts like Vadodara, Surat, Bhavnagar and Sabarkantha. Researchers found various mutations of the virus, especially from the hotspot areas. They said the detailed analysis of the genomes is being done by the lab, which will help them in knowing local characteristics of the virus. This will also help scientists to develop vaccine against coronavirus. So far, GBRC has completed genome sequencing of about 133 samples, which is highest in the country. Aparna Khun, AIR News, Ahmedabad.
In Madhya Pradesh, the recovery rate of corona infection is 51.3%. Bhopal is the highest recovery rate in the state at 63%. Testing, treatment, quarantine management of COVID-19 has been managed better in Bhopal. Now the arrangements have been made in other cities on the lines of Bhopal. Overall, 194 new cases have been reported in the last 24 hours. As a result, the number of people infected with the coronavirus has increased to 6,859.
More than 1,38,000 tests have been conducted in Madhya Pradesh so far. 3,571, more than half of the patients have been cured in the state up to now. At the same time, the death toll has also increased to 300. Additional Chief Secretary of Public Health and Family Welfare Department, Mohammad Suleiman, informed that the number of patients in the state is now doubling on the 20th day, which is much better than other states. Hoshangabad and Raisen districts of the state have become free from corona infection. In some districts like Harda, Chhindwara and Alirajpur, no positive cases have been reported in the last 21 days. There are only 2 positive cases in Narsinghpur, while no case has been reported in Katni district. Survey teams are working in the districts where active cases are being seen and necessary measures are also being implemented by various departments. Sanjeev Sharma, AIR News, Bhopal.
In Uttar Pradesh, a patient with a history of HIV recovered from the coronavirus in just 6 days. The 34-year-old man who successfully defeated COVID-19 was admitted to King George's Medical University, KGMU, in Lucknow, after getting injured in a road accident. More from our correspondent.
The patient was brought to the trauma center of King George Medical University, KGMU in Lucknow after sustaining head injuries in a road traffic accident while he was going to Gonda from Delhi. The patient during treatment told doctors that he is HIV positive and his COVID-19 test report also came positive. Vice Chancellor KGMU, Professor MLB Bhatt, said that it was first case in the university in which patient was both HIV and corona positive, and since HIV patients have low immunity, his recovery in just 6 days is a morale booster for doctors.
3 समस्याओं से ग्रसित एक मरीज विश्वविद्यालय द्वारा डिस्चार्ज होना हम सब लोगों के लिए एक आशा की किरण लेके आया है, क्योंकि HIV के मरीज जिसका कि इम्यून सिस्टम खराब हो जाता है HIV में, ऐसे मरीज में कोरोना का संक्रमण होगा तो क्या स्थिति होगी, बहुत ही चिंता का विषय था। बहुत ही गहन विचार विमर्श विश्वविद्यालय में किया जा रहा था इस मरीज के लिए, लेकिन उस मरीज के ठीक हो जाने के बाद एक आशा की लहर है। लोग अत्यंत आह्लादित हैं और समाज के लिए भी ये शुभ संकेत है, शुभ संदेश है।
The patient had head injury and was mentally disturbed for some time also due to the injury. But now he has recovered and was discharged yesterday with advice to remain home quarantine for 14 days. Sushil Chandra Tiwari, AIR News, Lucknow.
In Jharkhand, with addition of 32 fresh cases, the total count of cases detected in the state has now surged to 409. Out of the 24 districts of the state, Sahibganj is the only district left in green zone, while all other districts have shifted to orange zone. After detection of first corona positive case from Khunti district yesterday, infection has spread across 23 districts of the state. The infection rate in the state continues to remain high among youths aged between 11 and 30 years. In Telangana, the coronavirus positive cases are going up, with 24 of the foreign evacuees testing positive for the virus during the past 48 hours. During the past 24 hours, 18 of the foreign evacuees have been confirmed with COVID-19. A report.
Though Telangana state authorities have initially thought that the state will become COVID-19 free by the beginning of this month, the spread of coronavirus is continuing in Hyderabad. In just 48 hours, 24 persons who had been stranded in foreign countries and brought to the state under Vande Bharat mission have been confirmed COVID-19, while the total number of COVID cases in Telangana gone up to 1920. The state reported 66 new COVID cases yesterday, with considerable number of people among migrant workers who are coming back to the state getting confirmed positive for the virus. However, the recovery from the disease also is high in the state, with 72 people recovering yesterday alone. So far, the state reported 1164 recoveries. Lakshmi, AIR News, Hyderabad.
In the Union Territory of Chandigarh, 3 fresh positive cases of COVID-19 were reported today. Our correspondent reports they are all from the same hotspot location in the city. Yesterday, 18 positive cases were reported from the same locality, including 9 people who reported positive late last evening. Nagaland today registered another fresh confirmed active positive case of COVID-19, taking the total tally to 4 patients.
Central Public Sector Undertaking REC Limited is spearheading the mission to feed medical staff in key government hospitals as well as poor daily wage labourers across the nation. The Power Finance Corporation, through its corporate social responsibility arm, REC Foundation, has partnered with Taj Sets to distribute nutritious meal packets for medical staff in Safdarjung Hospital, New Delhi. Every day, 300 food packets have been delivered to the frontline healthcare warriors of New Delhi. India and Australia are committed to take forward the initiatives of bilateral defence and security cooperation under the Strategic Partnership Framework. Defence Minister Rajnath Singh said both the countries provides a good base to work together in dealing with the post-COVID challenges. Mr. Singh today said he had an excellent telephonic conversation with the Defence Minister of Australia, Ms. Linda Reynolds. The Saudi press agency SPA, citing sources from the Ministry of Interior, today said that based on the recommendations of health authorities in the kingdom, lifting of partial curfew and the return of some activities amid precautionary measures is likely to come in force from the 28th of this month. Some more relaxations are likely to come in force from the 31st of this month. The agency reported restrictions in place to control the spread of coronavirus, including bans on domestic travel, holding prayers in mosques, and workplace attendance in both government and private sector are likely to be relaxed by month end. Some economic and commercial activities, including opening of restaurants, will also be allowed. Minor pilgrimage and visiting will continue to be suspended, and this will be reviewed periodically in light of the health data. International flights, however, will continue to remain suspended for the time being. Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program on All India Radio on the 31st of this month. It will be the 65th episode of the monthly radio program. Prime Minister Modi has invited people to share their ideas. People can dial 1800-117800 to record their messages and can write on the Namo app open forum or on MyGov. One can also give a missed call on 1922 and follow the link received in SMS to directly give the suggestions. People can share the ideas on topics till the 25th of May.
Union Minister for Road Transport Nitin Gadkari today inaugurated the 440-metre-long tunnel constructed below the busy town of Chamba as part of the Char Dham connectivity project. Addressing the Border Road Organisation BRO officials through video conferencing, Mr. Gadkari said the tunnel will significantly reduce the time taken by travellers on the Rishikesh-Dharasu and Gangotri stretch of the Char Dham highway. He said it will also avoid congestion in the city of Chamba and open up avenues of socio-economic development in the region. The minister informed that the project is likely to be completed by October this year, which will be 3 months ahead of its schedule. Under the Char Dham project, costing around 12,000 crore rupees, approximately 889 kilometres of highway construction is to be done. BRO has been entrusted for construction of 250 kilometre stretch leading to the holy shrine of Gangotri and Badrinath. Now let us take a look at the weather for today. The national capital is experiencing heat wave today. In New Delhi, the minimum temperature will be 29 degrees Celsius and the maximum will be around 46 degrees Celsius. Mumbai will see a partly cloudy sky. The minimum temperature will be 29 while maximum will remain around 34. In the south, Chennai will see a partly cloudy sky. The temperature will hover between 29 and 37. Kolkata will see a generally cloudy sky. The minimum temperature will be 29 while maximum will be around 33. On to north, in the Union Territory of Jammu and Kashmir, the minimum temperature will be 24 in Jammu while maximum is expected to be around 41. The city will see a clear sky becoming partly cloudy towards afternoon or evening. In Srinagar, minimum temperature will be 13 while maximum would be around 31. The city will see a mainly clear sky. In Gilgit, the temperature will hover between 13 and 36. It will see a mainly clear sky. Muzaffarabad will see a mainly clear sky becoming partly cloudy towards afternoon or evening. The minimum temperature will be 19 while the maximum will be around 39. And now, before we end the bulletin, the headlines once again. Domestic flight operations begin in Andhra Pradesh on the second day of resumption of airline services. Civil Aviation Ministry allows resumption of domestic charter flights. 8 flights to carry stranded Indian nationals to Kerala from the Gulf region under Vande Bharat mission today. Recovery rate of COVID-19 reaches 41.61% in the country, over 60,000 cured so far. WHO puts on hold clinical trial of hydroxychloroquine on COVID-19 patients. Kerala State Education Board exams for class 10th and 12th get underway. And Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program on All India Radio on 31st of May. And with that, we end the Midday News.